If you're looking to reduce knee pain in the fastest time possible, I'm going to share with you some of my best tips for getting quick results. My name is Ed. I run a physio practice in Southwest London, specializing in treating knee pain. Now, let's start with the reason why you need a fast relief from knee pain. Maybe you've got a running event, maybe you're off work, maybe you have a holiday that you want to be fit for, and you're just looking to try and make a load of recovery and a load of progress in the shortest space of time possible. So I'm going to go through 3 top tips for how you can make progress really fast. Let's get started. The first one would be dedicating an hour a day to doing some rehabilitation. Now, rehabilitation is another way of saying exercises, strengthening movements, range of motion exercises, or whatever it may be. And that amount of exercise would be similar to what you would expect someone in the Premiership, someone in elite sport to be dedicating to their knee to make progress in the fastest time possible. Most people dedicate 5 minutes a week or very little to doing a home exercise program. The question next is, which home exercise program should you do? And the reason why it's difficult to answer that question is because there's so many different knee conditions that need different types of exercises that it's very difficult to give you a really kind of general answer, because for some of you it may make the knee pain worse, and for some of you it may just not help at all. But generally speaking, we want to do some work for your quadriceps, your hamstrings, your calf muscles, your gluteal muscles, and range of motion. If that's limited, then we want to do some flexibility work for the knee as well. If we're getting issues with balance, control, then we might do some more work with single leg balance work or some pivoting and changing direction. If we've got issues with being able to jump and tolerate those more explosive movements, then we may do some more work in that department. But it's very difficult to give you really specific things to work on because there's so many different types of knee pain. But if you dedicated an hour to a home exercise program that was specialized to you, that would be how you would make progress really fast. The second most important thing when we're thinking about making really fast progress with knee pain is how we can reduce the pain. Now, you could use heat and ice combination. Some people find ice works really well on its own. Some people find heat works really well on its own. Some people find a combination works really well. But again, if you could dedicate a lot of time to that each day to really calm down the knee pain that you've got, that would be really helpful. Other things that you could try would be things like taping. So things like strapping the knee. There's different techniques that we might use, like McConnell taping might be good for someone with patellofemoral pain. Using some sort of brace or strapping, again, would be another way of getting you a quick win and some relief from when you move you around as well. Other things that we might try would be a quads massage. So we may do some work on just taking out the tension through your muscles on the top of the leg. There's some hands-on techniques that we might do as well, some patella mobilizations that we might do to try and get the knee joint moving. There's other techniques like immobilization with movement, which is where we would use our hands to facilitate movement. And that would be under the category of manual therapy. I've seen some people get good results with using dry needling, acupuncture. That can be sometimes a nice way to reduce knee pain. And if we really wanted to make really fast progress, then there has been occasions that we would use an injection. So that might be where we'd use corticosteroids to have an anti-inflammatory effect on the knee to help reduce sensitivity, so that person could potentially do a marathon or make progress a little bit faster. But again, that's very, very rare, and is something that we would let the patient and the doctor decide on, because there's obviously pros and cons to doing that as well. The third thing that I want to do if I was wanting to make really fast progress would be definitely to see a health professional that specializes in treating knee pain. Seeing a health professional that specializes in treating knee pain is a bit like buying a map before you go on a journey. Rather than just following the signs or kind of making it up as you go along, seeing a specialist, buying the map, getting a really specific route to how you'll get better is going to save you a lot of time. It's going to save you a lot of stress and save you a lot of frustration. If that's possible, then that would be a really strong recommendation for you to make faster recovery. Doing it on your own means you're more likely to make mistakes, potentially irritate the knee on your journey to getting better, which is reduced when you see a specialist. The fourth thing that I would definitely do if I was trying to make progress really fast is to reduce or cut out anything that was irritating the knee. Now again, this is specific to certain conditions. For a tendon, for example, we might actually not follow that rule, but more broadly speaking, if we're reducing irritating the knee, that means it's able to heal and settle down faster. If we're constantly sensitizing and irritating the knee, then we struggle to make progress and the tissues that are irritated continue to be irritated. But again, that's sometimes not the case. Sometimes with a tendon, we may expect a little bit of pain along the way to getting better, and that isn't a sign of concern. So broadly speaking, you do want to try and reduce any activity that's causing pain, because let's say we've got a deadline which is 3 weeks, we've got a marathon. During that time, we're actually going to be using that time to try and minimize the likelihood of irritating the knee, because we've got then less time for it to settle back down between when it's irritated and when the marathon is. So we might be using things like cross training, we may be doing alternatives to the particular thing that might irritate it. So we're going with quite a low risk strategy. And the fifth thing that I would do to make sure that I made the fastest recovery possible would be get good sleep, get good rest and recovery. I wouldn't be going out drinking alcohol and partying and spending lots of time, not sleeping and having lots of late nights. I would get really disciplined with my rest and recovery and make sure that I was getting very, very good quality rest. So my sleep hygiene would improve. Similarly, other lifestyle factors would be definitely diet. There'd be certainly foods that I would be avoiding and food that I would definitely be wanting to take on, for example, protein. It's a bit beyond my scope of practice, but I would be definitely doing extra research into what foods would be beneficial for me to be eating and avoiding when I'm trying to make a quick recovery. Other lifestyle factors, again, would be thinking about smoking. I wouldn't be doing that. Vaping, anything to do with that nicotine, that's going to impact on healing times, as well as high stress. So cortisol, the stress hormone, is going to inhibit and interrupt the healing process. If we're really stressed over that period of time when you're trying to recover from knee pain, sometimes reducing stress just isn't possible, but it's certainly something that I'll be trying to mitigate if I was trying to make fast progress. So they're my top tips for making progress fast when you want to get rid of your knee pain in the fastest time possible. Hopefully you found this helpful. Leave your questions in the comments box and I'll be happy to help.